Hello and welcome to lyra.com, and the subject of today's video is gonna be ANS analysis, so analysis of the autonomic nervous system. And whether you are a natural practitioner, a homeopath, or just a regular MD, it doesn't matter. ANS analysis can help you a lot with your diagnosis as well as with your therapy, with customizing your therapy by seeing immediately how the patient reacts to the prescriptions that you've made and the therapies you apply. We're gonna show you, of course, everything that you can detect by performing an ANS analysis, and also present to you one of the most convenient, affordable, and powerful packages or devices available on the market today that will help you analyze the autonomic nervous system and its reactions to stressors, to medicines, etc., etc. And we're gonna give you, of course, also some practical examples on how you can interpret the results and what kind of insights you can win from ANS analysis. So without further ado, let's dive right in and learn more about it. And as you know, the ANS is the control tower of all of the organs, so it also interacts with the heartbeat. And the Chinese physician Wang Shuhe already said in the 3rd century AD that if the heartbeat would be as regular as the knocking of the woodpecker or the raindrops falling on the roof, the patient will die within 4 days. And the autonomic nervous system is a part of the mammalian nervous system that is responsible for the control and regulation of the involuntary bodily functions, including, of course, your heartbeat, the blood vessel constriction, the breathing, movements of the visceral smooth muscles necessary for digestion, as well as the endocrine activity and mobility. And the ANS consists of 2 subsystems, the sympathetic and the parasympathetic, whereby the sympathetic acts stimulatively to prepare for physical action or emergencies, or the fight and flight reaction, and the parasympathetic system calms, is stress releasing, and is for the so-called rest and digest control function. So they both act together antagonistically, so one activates and the other one comes down. Both subsystems trigger and control the regulative feedback to different stressors, or to changes in your environment or in your body, either from the direct cellular milieu, so your connective tissue, your cell metabolism, or psycho-emotional stressors, or from external environments, so microbes, toxins, stress, etc. So let's make the connection between the autonomous nervous system and the heart rate variability. In the past, we humans lived more in a flight and fight mode. However, due to our intense physical activities, those life stresses were easily neutralized. Today, however, we live in a permanent, dangerous, stress-dominated situation that, of course, means a domination by the sympathetic nerve. And our physical activities, unfortunately, are not sufficient. They are very much reduced compared to earlier times. Sedentarism is another stress factor that we suffer from in our society with our lifestyles nowadays. Our nutrition is often unhealthy, and we have become psychosomatically very heavily burdened, therefore, which means that our blood pressure is too high, we develop hypertension, we have problems with coagulation and glucose, with our metabolism, with our genitals. Our immune system is weakened, the digestive system as well, our muscle tone is weaker, we develop therefore dangerous conditions such as diabetes, infertility, erectile dysfunctions, frequent infections, pain conditions, irritable bowel syndrome, and many, many more. And here is where the ANS plays a very important role. As I've mentioned, it is literally the control tower of your body. It controls unconsciously, so not involving your conscious mind, different cells and functions within your body. For example, the smooth muscle cells, or your blood vessels, as well as the muscles that are necessary for moving, cardiac muscle cells, gland cells. And if you want to know more about all of the functions of the autonomic nervous system, I'm going to post a link to this wonderful video by the Khan Academy in the description box below, and you can go more in depth into that. Let's explain more in depth the link between the autonomous nervous system and the heart rate variability, or short HRV. So the autonomic nervous system consists of the sympathetic, so the fight or flight reaction, or in the parasympathetic, the rest and digest reaction, and they work together antagonistically. And the heart rate variability describes the beat-to-beat variations in your heart rate. As you can see also from this graph, if you have a low heart rate variability, the heart rate goes between a low and high in a very small amount. If you have a high heart rate variability, as the name already suggests, the range of the heart rate is much higher. And here on the right, you can see how the heart rate connects to your brain and to your autonomic nervous system and what the exact interactions are. And here we see a chart of such an heart rate variability measurement. So what do we measure? We measure the time interval from R spike to R spike, and a higher variability in the heart rate means a higher adaptability of your organism. Here we see two other examples. The top picture shows you a very good heart rate variability, and a higher variability means that the organism is more adaptable, and this means it can remain healthy despite of the inner and outer stressors. On the bottom you see a rhythmogram of a very bad heart rate variability, so this can be translated into an autoregulation rigidity, and this normally means illness. You can also look at heart rate variability in a so-called histogram that you see here, and you want to see a bell curve as you see in the top graph, which means it's a very good heart rate variability. On the bottom picture you can see how a bad heart rate variability looks like in a histogram. Also very helpful in judging the functioning of the autonomous nervous system and the heart rate variability is a so-called scatter diagram, and here you want to see a nice wide scattering as you see on the left. This means the patient has a very good heart rate variability, and therefore its autoregulation or his or her autoregulation capabilities are very good. On the right side you see how a bad heart rate variability would look like on a so-called scatter diagram. Okay, another very important thing to understand is that there are many HRV and ANS parameters which can be looked at and reported. However, many of them are redundant and play no significant role in establishing a correct ANS diagnostic, and that's why when you get the ANS analysis system from Lyra.com, of course link as always in the description box below, this system concentrates on the main 6 parameters that give you the most important information that you need, and those are the so-called SDNN, which is the standard deviation of all NN intervals that we measure. The SDNN describes the median of the variability. It consists of parts of the sympathetic and the parasympathetic nervous system, and the SDNN can be described as an overall variability or total power. And you can describe it to the patient also as the total power of the regulatory system. The other parameter that we look at with this system is the so-called RMSSD. So those are time domain parameters. The RMSSD is the parasympathetic nervous system activity, and the square root of the root means square of the sum of all of the differences between successive and n intervals. And here higher values indicate an increased parasympathetic activity. Then we look at a parameter called SI, which is an indicator of the activity of the sympathetic nervous system, so a stress index, and it of course reflects the sympathetic activity. Then we look at a parameter that is called nonlinear HRV parameter alpha 1, or DFA1 for short. And this detrends fluctuations in the analysis. So the alpha 1 does not just measure the timely changes of the heart rate variability, but rather the quality of the regulation. And by checking the HRV signal for random and recurring intervals, you can determine how the individual control systems work together. And the ideal value for the alpha is 1.0. And this shows that a heart rate variability consists of 50% random signals, and that indicates a fast reactivity of the organism, and 50% recurring signals, which indicates a fundamental stability of the control system. Values above 1.0 mean more stability and indicate compensations processes with the individual control systems, and values below 1 mean a lot of randomness. Values below 0.8 indicate a hindered cooperation of the control system, and that condition can be described as a chaos within the autoregulatory system. The ANS analysis system comes with two different views that you can display on your tablet. One is called a patient's view, which is a simplified graph with only 3 main values that are shown, and you as a therapist will get a more extensive view with all of the 6 parameters that would make the whole explanation too complicated for the patient to understand, but is important to you, of course, as a therapist. And first, let's look at a patient's view and explain a little bit what the patient is going to be able to see, and then we have a look at the therapist view that will help you with your analysis in depth. ANS analysis workflow is based on the detection and subsequent interpretation of 520 technically flawless RR intervals, so the intervals between the heart rates, and the test duration is only between 5 and 10 minutes, depending on the pulse of the patient. The test sensor, this is also very convenient, is a chest strap with a measurement resolution of 1 millisecond, so extremely precise, and data from the chest strap is transmitted digitally and wirelessly to the receiver, so no cables to deal with. The patient sits down during the measurement, and prior to being measured he gets time to calm down for 10 minutes, so we get accurate measurements. And the following illustration and calculation of the main ANS parameters is then performed automatically by the ANS analysis software. And this system has been optimized for routine applications in clinics and practices, so that you as a doctor can quickly and easily analyze and interpret the measured data. Also very important to know is that the ANS analysis system has been validated as a medical device. The bars in the different colors represent the standard values that have been determined according to worldwide validated specialist literature. In the best case scenario, all parameters should be in the green normal range. The values within the brackets show the normal range, and usually the red and blue bars are being discussed with the patient, as they represent the 2 main autonomic nervous system innovations. You will receive the patient view that you can see here with the 3 main indicators or parameters that are being measured. So you can discuss them with your patient. And next, let's have a look at what is your more extensive therapist view. And here we have it, the doctor's view. The doctor's view offers 2 additional parameters, as you can see, compared to the patient view. So you get also the alpha 1 value as well as the SDNN. And the alpha 1 value indicates the quality of the regulation, as we've discussed already. So the more it increases, the more compensation processes are taking place in the body. And the more it decreases, the more chaos is taking place within the system. It is a sign for a collapse of the control systems. And the question becomes for how long the body will be able to withstand this dysregulation. A decrease of the alpha 1 in combination with an impaired regulation, so a dominant sympathetic nervous system, represents an increased risk for heart conditions, and in a dominant sympathetic nervous system, all organs are controlled by this nerve. Then you get also the value called SDNN, which is the standard deviation and consequently the overall variability of the measurements. The more this SDNN increases, the greater the variability, and this also means the adaptability of the autonomic nervous system increases. The more the SDNN value decreases, the lesser the variability. And this means there is a limited autonomic regulation. So let's have a look at some real-life cases and how we can interpret the results and how it will help us with our diagnosis as well as our therapy approach. If we look at the arrhythmogram, the histogram, the scatter plot and the bar graph of this patient, we will see at a glance that this patient is quite healthy. He has a good heart rate variability. In the histogram you can see a nice bell curve. The arrhythmogram also shows a nice variability, and the scatter plot shows a nice scattering of the measurement points. So this means that this patient's autonomic regulation is working pretty well. You can find results like this in patients when they feel stress, but the stress has not become persistent yet. The patients exercise physically and do relaxation and stress relief practices to counterbalance the stress. And these patients will have also a very good regulation of the blood pressure because of that. In this second example, we can see totally different results from the first one that we looked at. If we have a look at the arrhythmogram, it's very flat, so very little heart rate variability. In the histogram, we also do not see the nice bell curve distribution. And in the scatter plot, the measurement points are not scattered evenly in a nice elliptic shape. Also, if we look at the graphs, in the bar graphs, the values thereof, we see very low SDNN as well as RMSSD and alpha 1 values. So we can say at a glance that this patient is not doing very well. He has or she has a highly impaired regulation capability, and if this continues to persist, this might lead to different chronic and acute diseases, even though thus far they do not exist. If we look closer at the SDNN and alpha 1 value, whereby the SDNN indicates a lack of variability and energy, and the alpha 1 indicates a collapse of cellular communication in the control system, we immediately see that this patient should see a cardiologist immediately because it does not look well at all. Analysis like this, or results like this, can be found in patients that suffer from a profound burnout syndrome, also patients with high blood pressure that is not well regulated, and patients that are diabetic and close to a cardiac diabetic neuropathy. So what about this third example? What can we see here? Well, monitoring via this ANS analysis system, we can immediately show impacts of therapeutic procedures and medications, as I've mentioned already. And here we see an extremely increased parasympathetic nerve activity, so the RMSSD, the blue bar, is extremely increased. And the sympathetic nervous system, so the red bar, the SI value, is barely active. If you see such measurements, you should double check the charts of the arrhythmogram, histogram and scatter plot to rule out potential heart rhythm disturbances. In this case, there are no heart rhythm disturbances, and this becomes clear when we look at the histogram and the scatter plot, which both look very, very good actually. The distribution of the bars within the histogram should resemble a bell curve, as I've mentioned already, which is the case here, and a scatter plot should look like an ellipse, and this is also the case. It is also important for the arrhythmogram that you can recognize a continuous recording, and there should be no random spikes going up and down without any structure. And here we can clearly see that the curve is moving up and down with a certain structure, which is good. This patient is probably taking beta blockers, and those have been overdosed, and the patient is also not feeling well, complains about a lack of energy, and beta blockers should be slowly reduced or eliminated altogether and replaced with a natural, much more side effect free medication such as Strophanthin or Obain, which by the way you can also get at lyra.me exclusively. Links in the description box below as always. Another case. In the first measurement we can see increased activity level of the sympathetic nervous system. So the SI bar, the red one, shows a high value, and a decreased value of the parasympathetic nervous system, so the blue bar, the RMSSD bar. The SDNN is slightly impaired, but the alpha 1 is still in the green normal range, as we can see, and so here we as a practitioner will perform another ANS scan. The second scan on the right shows the red bar is still higher than the blue bar, so what is going on here? The ANS Analysis Professional System offers you an integrated respiratory therapy which will stimulate the parasympathetic and the parasympathetic nervous system immediately, and we can use that in such a case to get a more clear conclusion on what is going on with the patient. So comparing the bars in the example, the sympathetic nervous system influence has clearly decreased, and the parasympathetic nervous system has more than doubled from a value of 10.6 to a value of 22.6. We can also apply the so-called Vagus-Witt respiratory trainer here, and if the respiratory therapy brings none or only minimal improvements, we can assume that the condition of the impaired regulation is already persistent. The arrhythmogram shows also that the HRV adapts to the respiration pretty well. Here we have another example of a totally different looking result from the measurements. So what can we see here? We see conspicuous spikes in the arrhythmogram first. And then when we look at a histogram, it does not resemble a bell curve at all. There is not only one scatter cloud that looks like an ellipse, but rather 4 smaller scatter clouds in the scatter plot also. So what does these all mean? The ANS parameters also, if we look at them, show a parasympathetic nerve that is in the red area at the top. Such values are normally not physiological, and ECG recording would be recommended in such a case because we have such striking values to get more clarity. And this measurement represents a profound cardiac arrhythmia and is therefore not analyzable with such a system, but at least we know in which direction to go. The therapy should be based on the elimination of the cardiac arrhythmia, of course, and the best way to treat this is to recommend the patient to take Strophanthin 3 mg per pill plus specific supplements, for example, to take care of his or her condition. Alright, now that we've looked at some examples and how the autonomic nervous system connects to the heart rate variability and how we can determine what is going on with the patient by looking at all of these values, what are the indications that we can work on with the ANS Analysis Professional System? We can use it, of course, for all of our checkups. So frequently, if all the checkup values are correct and all right, then we know that a patient is doing well. However, the autonomic imbalance shows the organs are being regulated at a maximum tension level, and there we need to intervene, of course, with our therapy. Patients also with permanent stress can be tested very well, so we can objectively assess how the body of the patient can handle this stress. Diabetics, with diabetics we are able to assess the risk of a cardiac diabetic neuropathy. Cardiovascular patients can be checked that are also medicated, and we can assess the dose of the medication that works best for them and the risk for secondary diseases. Patients with a risk for a CHD, many studies have proven that the ANS analysis is a great tool for risk assessment for those kind of patients. Also, we can treat and diagnose patients with sleep disorders. All preventive medical examinations can be performed with this system, so we can objectively illustrate the autonomic regulation and also assess the potential risk factors of our therapy. Patients also having a menopausal troubles, as the symptoms could get worse in case of an autonomic imbalance. Pregnant women, as a balanced autonomic nervous system is very important for the regeneration and the well-being. Patients that would like to get pregnant also with an increased activity of the sympathetic nerve. Cancer patients, of course, before, during and after the chemotherapy or any other treatment, in case of an imbalance of the autonomic nervous system, we can adjust the therapy accordingly to reduce side effects or shut down the chemotherapy or the radiation therapy and switch over to non-toxic natural products if that is necessary, if the patient reacts badly to those. Also, patients with musculoskeletal system pain, so permanent sympathiconia that adds to pain exacerbation. The parasympathetic nervous system is necessary for healing processes, and using this ANS analysis professional system, you can assess whether the patient already has blocked regulation or whether the regulation is still able to deal with the pain stimuli. Also, we can check patients with degenerative diseases, as the parasympathetic nervous system is imperative for healing and regeneration. Also, patients with erectile dysfunctions, as the parasympathetic nervous system is responsible for the erection. Patients with depressions can be assessed very well with the system, as well as the severity and duration of the depression. Patients that suffer from a burnout syndrome, as we can assess their autonomic regulation capabilities. Patients with a tinnitus to assess the autonomic regulation and therefore to adjust the therapy accordingly, and patients having recurring infections, because this means that the immune system shuts down or is not working properly, and this may be a result of an increased sympathetic nervous system activity. So what are the main features of the ANS Analysis Professional System? Well, first and foremost, it has been designed for medical practice. It is not an app for consumers. During the analysis, the ANS Professional System measures and displays the 6 most medically relevant HRV and ANS parameters that we've discussed already. And to ensure the utmost confidence in you as a healthcare giver and your patient, ANS analysis delivers valid and reliable values. The system is regularly synchronized with the scientific Cubios HRV software. There is also an automatic data correction function integrated in the system. It's the only system on the market which contains exclusively medically validated study-based standard values, and the validated standard values have hitherto been in the age range of 20 to 80 years, but now for no additional cost it comes also with validated standard values for people below 20, so you can now also analyze younger patients. The ANS Analysis Professional System can also be extended with some add-on modules. First we have the ORTHOSTATHIC, then we have the IHT module, then the long-term module and the vagal trainer module, and in the next part of the presentation I'm going to explain to you what each of these modules does. But back to the basic package, you can record a defined number of heartbeats to ensure comparability. You get, of course, the capability of immediate evaluation of your measurements, free software updates and no maintenance contracts, integrated cardiovagal biofeedback, administrative capabilities of unlimited number of patients and an unlimited number of measurements that you can perform on each patient. You get also the capability to compare and to display the progress of up to 10 measurements. You can select the parameters to be included in the comparison. For example, you can look only at the parasympathetic or the sympathetic course. The diagnosis entries are organizable in an alphabetical order or according to ICD-10. So the 120 most frequently used ICD diagnosis of therapy records for conventional medicine and naturopathy. You also have the capability of printing out automatically the analysis results via a Wi-Fi printer. It can be connected via USB and to your PC, and you can store the ANS analysis as a PDF for the index card and your practice program. You can also send the results via email with an explanatory text to your patient. The data export is also possible for further evaluations or for studies or scientific works. You can export the data in an universally recognizable format to other systems for analysis. You get also automatic data backup outside the hardware that is possible with an encryption. Different views and filter options for the patients and the measurements. Fast and illustrative therapy monitoring and comparative measurements, and the software is available in English, German, Italian and Chinese so far. Okay, now let's have a closer look at the additional modules that you can add on to the system. And first up is the so-called ORTHOSTASIS module. What is the ORTHOSTASIS module and how can it help you? Well, with conspicuously high parasympathetic values for a patient that is exhibiting signs of exhaustion and lack of energy, the question arises if these patterns are caused by a regulatory disturbance with a dominant parasympathetic intervention and a weakened sympathetic nervous system. And to better assess these kind of patients, a so-called orthostatic scan with changes of position must be carried out. 130 RR intervals are measured for the patient while he or her is lying down, and this is then followed up by an acoustic signal from the system as well as the note "please stand up now," and thereafter we measure another 210 RR intervals while the patient is standing. In contrast to the pulse breathing switched on of the parasympathetic nervous system, the change of position causes a stress impulse with a shutdown of the parasympathetic nervous system, and in comparison, a clear difference between lying down and standing up should be recognizable. The heart rate and the stress index, so the red bar, the SI value, should increase, whereas the parasympathetic nervous system, so the blue bar, the RMSSD value, should decrease. None or only very slight changes in the parameters are an indication of a regulatory disorder with a dominant parasympathetic nervous system and a weakened sympathetic nervous system. And in the next slide, I'm going to show you some graphs that will display how the ideal results of the orthostatic test should look like. And you will also see that the standing phase clearly differs from the lying phase. During the measurement, I recommend that somebody should always be with the patient, and the measurement in the lying down position is of course at the end compared with the results from the standing position. And here you can see the mentioned graph. The first part, also clearly indicated in green, is the lying down position, and then you see the stand up part, and then the measurement during the standing position on the right in red. You also see, apart from the RHYTHMOGRAM, this nice graph of the parasympathetic activity and how it changes during the change in position. But we also get, of course, this graph in the orthostasis module, which shows you the ANS main parameters that we've talked already about, and it will display, as you can see in the right upper corner, the ratio between the measurement lying down and standing up. And this is going to enable you to draw a lot of conclusions additionally, as we have discussed already. Another module that you can add on to the ANS Analysis Professional is the so-called long-term mode. So the long-term module makes it possible to carry out measurements without time limits. In addition to the display of the heart rate variability, the parasympathetic activity is also visualized as a blue line in real time, as you can see here on the right, and with a special marker and memo function that comes with this module, you can set individual markers and you write also individual memos before and during the measurement. The effect of the therapeutic interventions on the autonomic nervous system can thus be illustrated for more detailed therapy monitoring during the measurements. The third module that is available as an add-on to ANS Analysis Professional system is the so-called IHT module. So IHT means intermittent hypoxia training and enables the measurement of the parasympathetic activity in real time during so-called IHT training. And since the autonomic nervous system reacts directly and variably to hypoxia, the intensity of the therapy as well as the duration of the hypoxic and normoxic interval should be adapted to the ANS regulation. Thus, a too severe decrease in the parasympathetic nervous system can be avoided, and at the same time the patient's safety can be increased. And for the best possible assessment of the changes in the parasympathetic activity, the duration of the hypoxia and the hyperoxia phase, as well as the number of cycles, are adjusted according to the settings of the IHT device. How can the ANS analysis system help you with your therapy? Well, there are many options to treat autonomic imbalances. The effect of the therapy can be easily monitored with this system, and some recommended therapy procedures would be acupuncture, homeopathy, nutrition consulting, automolecular medicine, biofeedback medicine, craniosacral therapy, neural therapy, psychotherapy, osteopathy, autogenous training and yoga, meditation, progressive muscle relaxation, workout and exercise, oxygenation, etc., etc. However, the most efficient therapeutic effect is achieved with the matrix regeneration therapy, in our opinion, and here we have also a great tool available for you, which is called the MRT503. We just recently published a presentation on this system. If you want to have a look at it, I'm going to post a link in the description box below, of course. ANS Analysis offers already a cardiorespiratory biofeedback module with the so-called vagus vid module, which is great and helps you with your therapy. In the near future, the ANS Analysis is going to offer also interesting hypoxia therapy module. Some supplements that we recommend to support the autoregulation are magnesium, which inhibits sympathetic nervous system activity, potassium, which raises the parasympathetic nervous system activity, as well as coenzyme Q10. And here we can see all the features and benefits of the ANS Analysis Professional system at a glance. Its scientific character. So it's based on positive validation studies, it's evidence-based standard values that are based on studies from the last 20 years. It also comes with absolute risk cutoff values, which is very important. It has a reliable artifact correction, so if there are some random measurements that intervene with having a clear picture, then it will automatically correct these artifacts. It's also great for patient compliance, so you get understandable graphic representation that we've seen. The measurement is wireless. You get objective therapy monitoring. It's great for prevention. It's the best prevention tool. The email notification function is great, so the patient can receive automatically the results. Also, it's very practical in its application, so it has limitation to the recommended and practice relevant parameters, so these 6 parameters that we've discussed. The operation is very intuitive. It's on an iPad, very simple to operate, clear graphs, very easy to understand the whole results, also very easy to operate and to manage. Small and handy, of course. Cardiovagal feedback, biofeedback integrated. We have a support function for evaluation issues, so if you are not clear about the measurement result, what it means, you can contact us. You get also immediate evaluation of the measurement results, and it's also very economic and efficient. It's quite easy to amortize. The leasing rate, for example, with only a few patients per month, you can delegate the performance as it is so easy to operate to your nurse, for example, and it takes only between 5 and 10 minutes to perform this analysis, so it's very time efficient as well. So with that being said, it's time to wrap it all up and see what we've learned about the amazing ANS analysis system. The ANS analysis offers you the unique opportunity to gain a very fast and easy insight into the regulatory capacity of the autonomic nervous system, and the functional state of the ANS provides important information that allows you as a doctor to assess the health conditions or disorders better than ever before. The measurement results help also to answer many questions, including: to what extent do risk factors exist for cardiovascular diseases or other chronic dysfunctions? Is the patient's body able to cope with stress, or have stress factors already produced a health impairment? Are my applied therapies already successful, so you can monitor your therapy results, or is the dosage and the medication correct, or does it have to be changed? Which therapies can improve the functional state of a disturbed autonomic nervous system? We can also monitor the health effects, of course, and find the real causes of the disturbances. And these are just a very few of the many questions that the ANS analysis can answer better than anything else. For this reason, it is recommended that the ANS analysis is performed both as a preventive measure and also for patients with stress symptoms, chronic illnesses, or problems and conflicts at work. ANS analysis, as you have seen, is painless, it's non-invasive, it takes only about 7 minutes to perform, so it's very quick. And you will also benefit from the most professional training and technical assistance services if you purchase this system. It's portable, as you've seen, it's on your tablet, and it's very affordable. The most affordable validated, so clinically and value validated system for your medical practice. For each scan, you as an MD can build medical insurances, for example, $250 per patient. So you will amortize the cost of this system very quickly. More than 1,000 ANS professional units have been sold worldwide so far, and the numbers are growing constantly, of course. And just for you, as an extra, for the first 25 orders, we offer the ANS analysis system with all of the mentioned modules included for significant price discounts. So be quick, give us a call or contact us at shop@lyra.com. I'm gonna post the contact information, of course, in the description box below for your convenience. Do not hesitate. When you are within the first 25 who order this amazing system, you will get benefit from significant price discounts. And with that being said, I hope that you've enjoyed this information and found it helpful. If you did so, please do not forget to like, share, and subscribe to support our work. And until next time, stay healthy.